I'm Alan Hughes. I'm Professor of Cardiovascular Physiology and Pharmacology in the Institute of Cardiovascular Sciences. As many of you may know, heart disease and disease of the circulation are the biggest causes of death worldwide. Heart failure affects getting on for about 1 million people in the UK, and it's a serious condition. Indeed, people with diagnosis of heart failure, about only half of them will be alive 3 years after the diagnosis. So that's worse than most cancers. The majority of people nowadays with heart failure have heart failure because of diastolic dysfunction, so an abnormality of the heart during its relaxation phase. We've recently completed a large longitudinal study of triethnic community in West London. In that study, what we found was that heart failure was more common and more severe, and abnormalities of diastolic function were worse in ethnic minority people, South Asian and African and Caribbean. This abnormality of diastolic function was associated with abnormalities of heart shape. We don't fully understand why heart failure is more common in ethnic minorities, but we suspect that the changes in heart shape confer risk through worse load and worse stress on the heart. And that's the hypothesis that we're aiming to address in combination with Rio. So now I'll hand you over to Rio, who will talk about the technical aspects of this project.
Hello, I am Rio Tori. I am a lecturer in Mechanical Engineering Department at UCL. As Alan explained, it is very important to quantify stress or load level in the heart muscle in order to understand the disease better. To do so, we don't want to put physical sensor or anything into patient's heart muscle, which may make the patient awkward, but we will use a combination of echocardiographic images and finite element analysis. Echocardiography is a great imaging method which is done non-invasively using ultrasound, and this is using an ultrasound probe placed on the chest. Echocardiographic images, particularly those from a special technique called speckle tracking method, will give us a geometry of the heart muscle as well as how it moves around during the heartbeat. The mechanical stress in the heart muscle will then be quantified using finite element analysis, in which the equations of force equilibrium are solved on the computer based on the overall deformation information captured by echocardiographic images. Our approach realizes quantification of the stress level in the heart muscle without putting any physical sensor in the patient. This is very suitable for following large number of patients over a long period of time. Therefore, it provides a unique set of data to improve patients' care of the heart failure.